Your voice, your opinion, your community. Fact TV, free speech, protected.
The following is an independently produced program. The views and opinions expressed are entirely those of the producer and do not reflect those of Falls Area Community Television, its staff, or board of directors. Take a deep breath. Remember this is public access and carry on.
Secrets in the shadows, lost and found. Truth in every echo, loud and clear. Keep on with the long road, no more fear. In the halls of power, whispers grow. Every secret cut beneath the undertone. Honor stories hidden in the glass. On this long road, in the truth we trust.
Hello, I'm your host, Chris Roberts. Welcome to The Long Road. It's glad to be back. I spent almost 2 weeks down in Georgia. My grandson, Rezin, got married and went on an ocean cruise for his honeymoon. My other grandson, Moses, I got to watch him in the lodge school soccer semifinals and finals as they won the Georgia soccer title 2 years in a row. So in 3 years, when Rezin was on the team, they were runner-ups, and they've been champions the last 2 years. And Moses then graduated out of high school the next day. It was really good to see most of my family. My oldest grandson was in the Air Force, flew in from North Dakota with his wife, who's due to have a baby on July 25th. And can't wait for that to happen. I will be out there going to North Dakota. I also got to see my two great-grandsons, and it was amazing how much they got along. There was only like 4.5 months difference between them, and it's kind of strange because of their fathers. There's about 6 months difference between them. I guess daughters and their sons are always competing against each other. I saw my other grandson who was in the Marine Corps, and he was able to come in. And so it was really good to see the vast majority of the family. I just missed one daughter and 2 grandchildren there. But it was good. I enjoyed it. And I think it's really important that families get to see part of their families. You know what? We're doing too much time disconnecting from our families. You get up, you move, and it says, sorry, Mom, sorry, Dad. We just don't have time to come and see you. We're working. Or we have to go to the kids' soccer game, then the kids' baseball game, and then the kids' basketball game. Well, those days are really important. Very few of the kids are even going to make the high school team. Even less are going to make the college team. And an infinite number are going to make the major leagues. Look at basketball. There's only 450 guys in National Basketball Association. But you can't, I think it's really important that grandchildren and now great-grandchildren get to spend time with some of our elders. And I think they would appreciate it. Well, in the past couple of weeks, needless to say, just watching the national news, international news, all kinds of stuff is going on. We're like pinball in one of those machines. You know, it's almost like a pinball in a pinball machine. I used to get to play for a nickel as a kid. Something bounces here, you have no idea where's it going. And so constantly, oh, we're going to have a 50% tariff. No, we're not going to have 50% tariff now. Or I'm going to decide that we're not going to put the tariff in until June 9th. I'm going to have a 145% tariff, but I'm going to change it. But I'm only going to have it on these items. It's it's all over the place, and people don't know what to expect, and there's so many things that are happening that people have no idea that are happening. AmeriCorps, a great project, a great program that was there to help kids, college grads and stuff, get trained in a bunch of areas. Well, under Doge, it was quietly eliminated, and the 32,000 training positions were gone. And the only thing that I could get out of that is most of the people that do AmeriCorps are minorities. Okay? And the whole purpose of that is not to give a handout, is to give a step up. The kids have to work, and they work in small minority communities training where there's not a lot of services there. And so, two big things that are going to happen. The first thing is the VA. By starting next week, depending who you listen to, and depending on how many decide to retire and stuff, about 60 to 80,000 people, less people, can be working at the VA. Think of that. 60 to 80,000 people who are now working at the VA starting next month are either going to retire or start being forced from their job. Say, even if we keep the bottom number, 60,000 people. If we go the high number, no, even if we keep it at 60, to give you an idea what that means every man, woman, and child that lives in Cheshire County disappeared. Okay? Just every single man, woman, and child in Cheshire County would totally disappear. Well, they're saying is we're not allowed the medical professionals and those individuals to take early retirement. We're going to require them to stay. But, but some of those medical people are going, wait a minute, I don't like the insecurity of this. I can be laid off or really forced to retire at the whim of somebody. Union contracts don't matter. Collective bargaining don't matter. Maybe I don't want to be here. And they're going to disappear. And you go 60,000. Okay. Wait a minute. So the medical professionals are not going to be allowed to retire. Well, they can retire, but they're not going to be forced out. They're not going to be able to take the advantage of, we'll pay you all the way to September 30th. Things like that. if you want to retire, you have to do the regular retirement system, and you're not getting any money, extra money. Okay. When I go look at my primary care provider at the VA, okay, I can look at her. She's not allowed to take the early retirement incentive. What about the 5 or 6 people that they're at the front desk taking care of everybody who's coming in to check in for their appointments, or taking care of everybody as they leave their PCP or a provider's session appointment, and now they have to schedule another appointment. What happens if they disappear? It doesn't matter if you have the provider there if you don't have the individuals to make sure you're at the right place at the right time. Okay, right now, on an average, last time I looked, it was 123 days. So if you saw me and we filed the claim to the VA, a fully developed claim, where if you had any outside medical records, we put the claim in, we put the 2122, we put the blank check, we put your DD-214, and we do the medical release. But if we did all that at once, normally right now it's 123 days. Basically, that's the average decision time. 123 days. Not long ago, it wasn't unusual to go 6, 9, 12 months. Sometimes longer. I still have claims who are not the fully developed, where everything's there, where other stuff has to be collected and everything. Some of them are over 2 years old. And they're just regular claims, and they're not appeals. I had one claim that took over 800 days. A simple claim for service connection on a knee. Well, so if a lot of people in the VA who are going to disappear are on the benefit side, the people who review the records, put out a request for exam, sends it to the contractor so the contractor can set up exams, get the exams done, turned in, review the exams to make sure the exams answer all the questions that the VA asks for. And once that's there, it says, okay, you're ready for decision. So now that person will take all this information and send it to a rater so the rater can make a decision. After the rater makes that decision, the rater then sends it to his or her boss to concur or non-concur with that decision. At the same time, while they're looking at it, then it also has to be sent really to the finance side to determine if you're service connected. When does that service connected start? It starts on the day of the claim, or it could have started a year early, up to a year early when you put in intent to file. Once they determine the start date of the service connected item, then they have to compute the pay of that. That gets signed off. And then again, it has to go to a supervisor to get signed off. Okay, so give you an example. A guy emails me and says he talked to the VA, and the VA says we need to get information from the National Archives. Okay, the information from the National Archives would be, was the individual in the service? When was the individual in the service? And what type of discharge he has. And the VA is telling the individual, the son, saying, we got to get this, we need this because we have to prove that he was in a certain time, so they would be able to rate applying for aid and assistance. So I go through the file and I go, oh, look at back in the file. The National Archives sent all that stuff. What do you mean, National? I go, yep, it's in the National Archives and it's in the guy's file. Yep, the individual was joined in like July of 1946. The official end date of World War II was December 31st, 1946. So he served at least one day in time of war, and he served at least 90 consecutive days. Well, what's happening is the VA says, we don't need all these people. We can just AI everything. Well, AI was looking for a DD-214, a release from active duty. And AI goes and says, nope, there is no DD-214 in this individual's file, so we cannot proceed with the claim. Okay? I go into the file and I get the individual's discharge papers. When people was released from active duty in World War II, there weren't any DD-214s. It's a WG-53. The WG-53 has everything that is basically needed on a 214 nowadays. And the WG-53 goes right on it, issue 1 July 53. That was the new updated version. It shows that he served from 46 to 48, showed that he was a private first class, showed that he had honorable discharge, showed that he was gotten the World War II occupation medal. Everything they needed was right on there. But because the AI couldn't find a DD-214, it directed the individual who worked for the VA to go to the National Archives and ask for a DD-214. Something that never existed, and something that the average person with experience would have gone and took care of it. Okay? The individual putting a claim in is over 90 years old and doesn't have too many days left. And they're putting it through this hassle. Give you an example. I have an individual, a veteran, prostate cancer. He gets his prostate removed and he gets ED. So I put a claim for him for ED secondary to prostate cancer. Okay, the claim comes back denied. And I'm going, why would it be denied if you have your prostate taken out or you have radiation or chemo? Those are pretty normal secondary conditions. So I'm reading the write-up. And the write-up was one of the justification for the denial is because the person who was looking at doing the review said, wait a minute, there's no way you can connect his ED to a service-connected condition. So ED has to be a secondary condition, and it cannot be, is nothing that he's service-connected for that would rate it. And then the next sentence says, well, if the individual had some organic diseases like prostate cancer, bingo. And it's like, the claim was secondary to service-connected prostate cancer, and you're saying it cannot be service-connected because the individual doesn't have prostate cancer. Okay? AI saw no problem with that. And I've asked a couple of times because there's numerous mistakes that people would have caught, and another paperwork, a claim was denied. The claim says we went looking for the 23rd Engineer Battalion 160 communication group in Vietnam. No. And then it went and said the 23rd Engineer Battalion was was home based in Arkansas. Well, the 23rd Engineer Battalion in the time and date in question was in Germany. The 160th Communication Brigade or Signal Brigade had been decommissioned a few years back in Oakland, California. And so it was like all these different mistakes. AI makes a decision, but AI doesn't go back and look at all the things that could possibly. And I've asked about AI. And you know what the VA has been telling us? Yes, we know AI is going to make a lot of mistakes. But when people catch those mistakes, we can use it to teach AI. What about all the people who don't catch the mistakes? Those veterans are screwed. AI made a mistake, and you, the veteran, it's your responsibility to catch it and report it so we can fix it. No, isn't it the VA's responsibility to do everything possible to get it correct the first time so you don't have to put the veteran through the anguish? And so, basically, what I think they're looking for is the way to slow down service. And when you slow down service, you save money. Okay? Why? Because the government actuaries already made a decision. When they went in and signed the PACT Act and said the camp was using water from 1953 to 1987. They said, the actuary said it's going to cost $6 billion. $6 billion. You go, wait a minute, $6 billion? How would they know that? Well, look at it this way. Okay. When you go back and you say 1953, so when they passed the PACT Act and it was signed into law, people back in 53 were 88 years or older. When the life expectancies for guys going back there might have been about 72, 73, I was able to help an individual that was there from 53 to 56. And when you go to 1987, the youngest individual is 54. So what you have done is, what they have said is, okay, our youngest individual is 54 and our oldest are 88 or older. And so they can put that right into the chart and they go ding, 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 ding. This is how many people should be alive, bang, bang, bang. You know, you had the standard deviation to correct it, but they know it. And then they go and say, well, out of every 100,000 people, they would have kidney disease. 30 would have kidney disease. 30. So they may say, okay, out of every 100,000 that were on Camp Lejeune, 50 have kidney disease. Okay? So when they go, yeah, we have the chart, and kidney disease is a loss of between 195,000 and 225,000. So then you get the range, and you go, and they plug all that in, and they come up with a number. Okay? No different when they added hypertension on to Agent Orange, or added Guam on. So again, so even if you use 75, so that's 25, 40, 25, 24, so that's 49, and 19. So when they signed the PACT Act, adding Agent Orange to it, I mean hypertension, the youngest Vietnam vet was 65. That's using the 1975 timeline. But if you do the 72 when the drawdown, that's 68. And so again, they run the numbers. Here it is, the lowest number is 68, and the highest number, say you run it from 68 to 100, and then they throw in the numbers, and they'll decide how much it's going to cost. Okay? So what the VA had been doing over the past 4 or 5 years is they've been giving out, oh, you got sleep apnea? We'll give you 50%. You got unstable knee, we'll give you 20%. You have ringing in your ears, you have 10%. So they gave out a lot of these disabilities that people have and people go to work with every single day. And now I have individuals, cases that I've taken care of in their 20 years old. They're in their 20s and the VA is giving them 100%. okay, they give him 100%. So that individual, even if he or she doesn't ever work again, the VA is going to pay him or her over $4 million over his or her lifetime. So now the VA is saying, well, we're going to save money on people. Is it really true they're going to save money on people? Or are they trying to find ways to reduce the money they pay for VA compensation? Because you got two budgets in the VA. One is the medical side, the infrastructure side, the healthcare side. That's at the whim of Congress. Okay, oh, we want to add 10 million, we want to cut 20 billion, yeah, Congress can do that. And so, but when it comes to the benefit side, that is mandatory funding. That unless the law changes, that is no different than us having to pay the interest on our debt. It is mandatory. And every year it goes up, it has to be paid in the budget. So now it's kind of going back and forth. We can control the hospital side. We can control the employment side. But really right now, we have no control over the benefit side. But there is a way to control the benefit side. You control the benefit side by reducing the percentage and the number of people that get benefits and how much they get. It's going to take a long time. People are going to have to really fight, and people are not going to be able to realize you might be able to get the exact same services that you need on the healthcare side. And I do not want to really hear and say, oh, the VA is screwed up. I wanted to go get there and I had to wait. I had to wait 90 days. I had to wait 150 days. I had to wait 6 months. Okay. I would like to see you as a brand new patient schedule an appointment for neurology, cardiology, urology, dermatology at Cheshire Medical. You will be lucky if you get in at all, if they accept you at all. So some people go, well, our VA can't get me in 30 days, I'm going to use community care. I'm going to demand the VA give me community care and pay them outside. Okay? You can get community care, but you got to find a provider. You're not going to get these specialists. New Hampshire, for example, well, we do not have those specialists in this area. Rural New Hampshire, rural Vermont, highly educated, highly talented, highly skilled cardiologists, urologists, neurologists. They're not coming here. If they come here, maybe be able to do the residency, but they're out the door. Because, look at this. If I'm one of these doctors, what is, for example, Keene or Brattleboro or Walpole has to offer? So, basically, you're left, I think the level of health care that the VA provides, it might suffer a little bit, but not that much. The reason being on the morbid side is one of the reasons it's not going to suffer that much, in my opinion, is the age of the veteran. Yes, we had wars for the past 20 years, but we had more veterans dying than people becoming veterans. Oh, we sent 150,000 military to Afghanistan, 120,000 to Iraq. You care to take a guess on how many were in the Battle of Okinawa? The Battle of Hiroshima? Pretty much the same, and that was only one battle. And so, that's the difference. And World War II veterans are almost non-existent. There's a few left. The Korean War is dropping off quicker. The ones that are dying off really quick are the Vietnam veterans, because again, average life expectancy for this group would be about 72, 73 years old. And that's average. That doesn't mean serving in a combat zone or other stressful problems. One of the things that the VA has been doing is allowing more and more people who have no service-connected issues to get VA health care. And the reason, okay, they have determined that it's much cheaper to provide a veteran VA health care instead of Medicare. And you go, what? They come out of two pockets. We work, we pay into Medicare. Okay? The government pays into VA healthcare. Pretty close to half the people, about 4 million veterans, have no service-connected issues with them, and they use VA healthcare. It's all based on income. If you don't have any, if you're really poor, you can get it free. If you're in the middle, you can get it pay co-pays. I know of some veterans who do not they live by VA hospitals or places. They do not pay the $185 a month for Medicare Part B and just use the VA. That extra almost $3,000 a year is really important to them, especially if you only get $900 to $1,000 a month from Social Security. So I suspect the amount of the financial level that you need to be below to get into VA healthcare, I suspect that's going to go up, because that whole group will fall out. They'll say, nope, you got to use Medicare. Well, yep, but not all doctors accept Medicare. More and more doctors say, no, I'm not taking Medicare because Medicare pays too little. So what happens if your only health care is Medicare and you can't find a doctor to take care of Medicare. And the other part is, if I use the VA healthcare, I get free hearing aids if I need them. I get free glasses if I need them. Medicare doesn't do that. Second, okay, I need a knee replacement. Say the knee replacement costs $20,000. Medicare says I'll pay 80%, so that's 16. Well, you get a bill of $4,000. Well, if you go have the VA do it, they take care of most everything, and you might have a bill of $200 or $300. So when you have both knees replaced and maybe a hip replaced, that's a lot of money when you don't have much income coming in. So on that part, if you service-connected disabilities, I don't see much change in your VA health care. But if you're that group who's getting VA health care because you're either poor or you're in that Medicare group, you may find yourself being it'd be very much more restricted to get into VA health care. And then it comes to the other one. Does a service-connected veteran get prioritized over the non-service-connected veteran? I'm going to have to wait and see there. But I think the really big thing that's going to happen is on the benefit side. You're going to see, I think, in my opinion, you'll see more claims rejected, or like it was before, the people are going to get a lot of lowball ratings, and it will be totally up to them to fight that rating. But if they just accept it or they don't know how to fight it, again, the system will screw them, but the system is doing what it's set up to do, is to reduce the cost of VA compensation, which is the mandatory budget item. And so the VA part was pushed off and slowly to creep, but the action is supposed to be starting in June. There's already people retiring, quitting. Because of last week, there was a message came out that everybody who worked in Manchester could no longer work remote, except in a few cases, they all had to be back in their offices. So if you've been working remote and you didn't have to pay a babysitter and all that kind of stuff for the last 3-4 years, and now all of a sudden you go back in the office and you go, oh, wait a minute. It really isn't in my best interest to work and pay a babysitter. Why should I work all these hours and get very little money at the end? So you got people who've already quit. There were people that are in probationary status. They hadn't been there long. They were already let go. And so there's a lot of turmoil going. I was with my doctor this morning, and they come, for example, down to Keene and run the diabetic clinic and stuff. And they said, well, we don't know if we can do these clinics anymore. It's looking like we will be required to work in our office in White River Junction. So if any of you individuals, you just been identified as a diabetic and you need to be told and taught how to handle it, what type of medicine, and they track, the only way you can do it now is you go up to White River Junction. So for example, I live 1.5 miles, maybe 2 miles away from the clinic. I went there for once a month for 4 months to get the training. Instead, in the future, I would have to drive up to White River Junction that 4 times, take what would have been a 2-hour class, now would have taken me 4 hours of driving, and then the government would have to pay me in that time over $200 for my mileage. And I'm trying to think, what's the benefit? So I think a bunch of these people are not thinking very well. And it's so things are going to change rapidly. And if you're a veteran, you know a veteran, a family member of a veteran, a widow of a veteran, I would be very proactive in trying to keep up to date as much as possible. Or if you're thinking about filing a claim, do it as quickly as possible, because I think after the summer is over with, I think there's going to be an extremely lot of turmoil. Okay? Switching over, I've talked about Social Security a couple of times. Well, Social Security, you can go, Dave Ramsey says take Social Security at 62. Whatchamacallit says take Social Security at 67. Or another one will say take Social Security at 70. And so, like for example, let me give you somebody who was born in 1958. They said, hey, if you take Social Security at age 62, you're only going to get 71.7% of what you earned. So, $1,000, plain and simple. So instead of getting a regular $1,000 if you retired at 67, you only get $717. Okay? That, basically that $1,000 is computed on the best 35 years that you worked. They take them all together, they average, they find out what that job would be costing now, they got certain inflation factors, they put all that stuff in and they come up with that magic number. So they say, well, you know, wait until you're 70 years old. And if you wait until 70 years old, instead of getting $1,000, I'll give you $1,267. Okay? Well, a lot of people, by the time they're 62, are so beat up, they're sick, they have other issues. A lot of people before they're 62 have heart attacks. People have strokes or other illnesses. People get laid off. No one wants to hire some 60-year-old guy. So what are they going to do? A lot of people are forced to take Social Security at 62 just to get income back into their hands. But even if I was going to get 2,000, I was born there, that means I'd get $1,400. Let's make 2,000. I'd get $1,400 a month. And then I subtract 185 from Medicare Part B. So I'm down to $1,200 a month to live on. Can you live on $1,200 a month here in Keene? I don't think so. If you had to retire at age 62, chances are you have little to no 401 IRAs or whatever. You probably, whatever you had, you were using to at least have money until you turned 62. and then maybe you slow down. So yeah, you wait. So you work another 5 years, and you get the 2,000. You take it up, so you get $1,800 a month. $1,800 a month doesn't go very far in Keene either. Well, if you work until 70, you get 2,500, so you get $2,300 a month. So here's a catch. I'll give you an example. I had a number of strokes, meningitis, a whole bunch of different craps. So I decide, you know what? I'm going to start collecting Social Security at 62. Okay? So I cooked it because I sat down, looked at the numbers, I looked at my illnesses and medical conditions and everything like that, and I'm going, you know what? It doesn't really make sense for me to wait until 70 to collect Social Security because I may only live about 3, 4, 5 years after that, and I don't get anything. I have a veteran who's really hurting, and he put in for Social Security at age 63, and he goes, I don't know what to do. I says, what do you mean you don't know what to do? He says, I can't work anymore. I says, who told you you can't work anymore? I says, the lady at Social Security always told me I can't work anymore. I go, what do you mean? Yeah, she said, if I'm collecting Social Security, I can't work anymore. No. Well, Social Security, they've been cutting a lot of people out of the Social Security department, just like they're cutting a lot of people out of the IRS department. I go, no. If you collect Social Security at age 62, you can still work. No, a woman told me. I says, I put in for Social Security for my birthday, and I had 2 checks, and then I was offered this job. So I said, what the heck? I'll take the job. Then they said, nah, hey, you got to give up your Social Security. I says, no, I don't have to give up my Social Security. He says, yep, you got to give up your Social Security. I said, nope. So I work, okay? That year, I got 7 Social Security checks because once you get to a limit, I think it was around, I don't know what it is right now, but it was 2 for 1. For every $2 I made over that, they took from my Social Security check. So say, for example, my Social Security check, I got 7 Social Security checks, so rounded off to $10,000. Okay? Then they take off. I didn't lose any money. But what happened was, at the end of the year, then my birthday comes up, and they says, Mr. Robert, bang, 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 we calculated for the 5 months, we gave you like 0.6, I think. So these 5 months that you didn't work, we'll give you 0.3. So instead of having 71% going forward, you'd get 74%. And, oh, Mr. Roberts, way back then, we noticed you only made $3,000, but this year you made $30,000. So we'll get away with that $3,000 and replace it with 30 and recompute it all over again and say you got a larger amount. So until I got my max retirement age, they did that every year. And even after the max retirement age, they're still doing it. And if you go to Walmart, you go to Target, you go to a lot of these places, there are a lot of older women who are working and collecting Social Security because they need to, because they live in Keene. Or they say, well, you don't want to work because if you make it below this level, you don't have to pay any taxes on your Social Security. But if you go above this level, you have to pay 85%. 85% of your Social Security money is taxable. So hey, you can say, wow, if I make $18,000 a year, I don't have to pay any money on my Social Security. Okay, that's a decision. Or you can say, hey, I got a job that paid me $35,000, but I have to pay taxes on my Social Security, so I'll have to pay $3,000 extra. So those are things. Okay, just because someone works for a government office doesn't mean they are knowledgeable. It doesn't mean they're providing you the correct information. If it doesn't sound right, ask someone else. If it doesn't sound right, ask Google. If it doesn't sound right, ask an AI. A couple of different ones, okay? And don't listen to the people that say, collected at 62, collected at 66, collected at 70. Because every individual situation is unique. No one knows if you have serious diabetes. No one knows if you have a serious heart condition. So there's a whole bunch, no one knows if you have cancer. All those get in. No one knows what your expenses are. Do you need this to make sure you save your house or have a good place? Is it almost impossible for you to get a job? You have to decide for yourself. Because most of the people who are making the decision for you are making the best decision for themselves, not you. So with Social Security and VA and some of these other ones, it's going to be more incumbent on you to get the information yourself. Because we have a saying in the Marine Corps, when you have a downsizing, the best people leave. They take the money and run. The cockroaches always find a way to survive.